Connected voice advocacy works with individuals. We ensure that people who are struggling to be heard have a voice. We ensure people can access services that they need and are entitled to. And we ensure that people's rights are upheld. As advocates, we do this by providing information, helping people to weigh up their options, helping people make informed decisions. We represent them when necessary and encourage them to self-advocate where possible. We challenge decisions and situations using legislation, and we help take people through complaints procedures when they're unhappy with the services they have. We ensure that people's choices are integral and that they are person-centred. We work in the community. We currently work in Newcastle and Gateshead on health and social care issues. Across Northumberland and Tyne and Wear, we provide advocacy to people who have been affected by hate crime. We deliver statutory advocacy when local authorities have a legal duty to provide an independent advocate to people affected under the Mental Health Act, the Mental Capacity Act, and the Care Act. As advocates, we support people who have been detained under the Mental Health Act to understand what their section means, to help them to appeal their section if they want to. We work with people in care homes who are being restricted under the deprivation of liberty safeguard. We help them to go to the Court of Protection when they're unhappy about where they're living and the situations they're living under. We help people to be integral to the care planning process. We support carers in their care plans for themselves and the people they care for. And we ensure that people who are undergoing a safeguarding inquiry are at the centre of the safeguarding decisions and that the people understand the impact of any safeguarding decisions made for them. We also work with groups. We bring together service users of the advocacy service to help them to shape the services that we deliver and to consult on their views on how we deliver our services. We work with families. Currently, we have an advocacy service in Newcastle supporting people who are going through crisis, particularly around their benefits. We also deliver specialist advocacy. We do this in the National Autistic Centre in Morpeth in Northgate Hospital. We provide specialist advocacy to people with autism. We also provide advocacy to people who have had a personal injury claim, usually left after an accident with a brain injury, and they need help to ensure that they are central to their rehabilitation planning and plans for their future. We also provide advocacy in other local authority areas where they are out of area and need an advocate to support them. We also provide child protection advocacy. All of the issues that we gather through the casework that we do helps us to identify on any trends that are appearing within the sector. We can then effect change. We can go to decision makers and commissioners. We can take part in consultations. The systemic advocacy is an important part of what we do because it ensures that the individual's voice is being heard in any decisions made around national and local policy.